Watche, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello everyone. On today's episode, we have Nicola Phipps-Wetalainen, an NP and nurse practice consultant for Ontario Region, Sioux Lookout Zone. She has practiced in the North and been a practice consultant for over 8 years now. She's been facilitating the prenatal content for orientation and has a keen interest in maternal and child health. Welcome, Nicola.
Thanks for having me here today. It's great to be on today's session.
So, what are we chatting about today?
Well, today I will be introducing the new Prenatal Complications iTacit module. The Prenatal Complications module is meant to provide an overview of a few of the common conditions we could see in prenatal clients. It is not an exhaustive list, as there are many other complications and conditions during pregnancy in which a client could experience. The conditions covered in the module includes anemia, gestational diabetes, hypertensive disorders, and bleeding in pregnancy. Many of these conditions are identified during routine prenatal visits, some by doing a good health history and review of systems, and others through our routine physical assessment, such as a blood pressure measurement with every prenatal visit. If these prenatal complications or conditions are left unmanaged, missed, or any delays in diagnosis, it could lead to serious maternal and fetal consequences.
These sound like important topics to cover. Is there any specific reasons why prenatal complications are in the spotlight today?
Well, we know that clinical practice is always changing. Northern nursing is unique. Continuing education and keeping up to date with the latest information is important. Did you know that according to the Society of Obstetrician and Gynecology of Canada and Choose Wisely, a urine dip during pregnancy is no longer recommended with each visit?
Wow, that's a good one to note, Nicola. Your analysis for protein at all prenatal visits was second nature to me by now. Any other interesting practice updates from the iTacit module?
Yes, other updates are, in the Sioux Lookout communities, we are also including an A1C with all prenatal labs. In addition, we're encouraged to offer screening for gestational diabetes with a 50-gram test, ideally before 20 weeks pregnant, especially if any risk factors are identified. Did you know that our Welch-Allyn vital signs machine, that's a WA4400, is capable of blood pressure averaging? This is also sometimes referred to as serial blood pressure measurement, or BP-True. Blood pressure averaging is an automated series of measurements followed by averaging of the results. This is current best practice for chronic blood pressure monitoring and especially for prenatals with high blood pressure. In addition, consider ectopic pregnancy as a diagnosis in any patient of reproductive age that presents to the nursing station with vaginal bleeding and or abdominal pain.
Those are all great updates, Nicola. Where can nurses find more resources?
I strongly encourage everyone to take some time to complete the Prenatal Complication iTacit module. For more information, the SOGC is a great resource for anything that has to do with women's health and especially all things pregnancy related. They have best practice guidelines and other healthcare provider resources in addition to patient resources. Lots of great resources can be found on their pregnancyinformation.ca website. Also, the FNIB CPG covers some prenatal complications, which I do encourage everyone to review at some point. Lastly, the Obstetrical Emergency Handbook should be in your OB kit at the nursing station. It is also available on One Health under Sioux Lookout Nursing Station Forms Northern Obstetrical Handbook. If you have any further suggestions about future prenatal-related topics of interest, please let the practice team know, as we are always happy to support your learning needs. Thanks for listening today and hope we talk again soon.
Thanks, Nicola. It's been great having you on today's episode. Thank you all for listening to the Practice Support podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.